Dr. Carolyn Dean, welcome to the Biohacker Babes. Thanks for joining us today.
Thank you, girls, and call me Carolyn, please.
Oh,
Okay, we will. Thank you.
Carolyn. Well, thank you. So this is an exciting episode today. We are going to be breaking down some myths and confusion around the topic of magnesium. And being in the health space, I think we've all heard the quote of that it's a cofactor in more than 300 enzyme systems. Even when I was back in school, I remember hearing that, but I think it's thrown around and people are like, okay, so that sounds like it's important, but what do I really need to know? So we also see that it's a really big problem today that people are deficient. We've heard our food supply is terrible. And then we go to the health food store and there's magnesium supplements everywhere. So to kick us off, why are so many people deficient in magnesium today?
Okay, so let me just backtrack a bit, Renee, because it's now up to 800 to 1,000 biological processes that require magnesium.
Wow. Okay.
Up
Thanks
to
for sharing that.
1,000. So it's huge, and it's
Super important.
80% of known metabolic functions require magnesium. And what I realized, I did my med school in the mid 70s, and all my biohacking since before then was about me trying to get healthy from magnesium deficiency. And I wasn't able to until I started taking saturating levels of magnesium in the late 90s, actually, the mid 2000s. So I spent all that time trying to treat myself for symptoms of magnesium deficiency, which didn't help. And I think that's what maybe is a factor in why so many young people like yourselves are into biohacking, because doctors don't know anything about nutrient deficiencies. We have to find that out for ourselves. We have to, try this and try that. But if you also don't know that magnesium is necessary for 80% of non-metabolic functions, you're not going to do that. Or if, as you say, people are catching on to magnesium, then you're just overwhelmed with all these choices. Besides the fact that most magnesiums on the shelf are laxative. You don't get enough magnesium to treat all your 80% of your problems, let's say, because you get the laxative effect before you get the clarity and the saturation. So I think we're all chasing, on a certain level, we're chasing magnesium deficiency. That's kind of like 3/4 of my whole focus and my philosophy of chronic disease. The other quarter, maybe up to a half, is yeast overgrowth. Now, I know we're going to focus on magnesium here, but when we started taking antibiotics and eating sugar, birth control pill, in my case, cortisol from the stress, we all start getting yeast overgrowth. And we're totally susceptible to it. I mean, I'm kind of here with a bit of brain fog this morning because I got a huge box of chocolates from a friend for Christmas present. And of course, I ate them. And it just blew my sugar, up. I woke up with a brain fog and puffy face.
No.
But what's my biohack for that? I did a coffee enema. Yay! So
Yeah, nice.
that is,
Glutathione to the rescue.
Exactly. So back to your question, why are so many people deficient? It's not in the soil. 100 years ago, you could get 500 milligrams of magnesium in an average diet. Now you're lucky to get 200. And I think we need at least 600 for maintenance. I had to take 1,200 milligrams of magnesium before my heart palpitations got under control. But I had to take a non-laxative magnesium, which is actually my own formula. So that's another stickler, that people really don't have access to non-laxative magnesium. So a lot of levels of problems. Then there's the fact that doctors don't have a proper blood test for finding magnesium deficiency. the blood test is so inaccurate that they do not even test for magnesium on your blood electrolyte panel. So doctors aren't even, you're there palpitating away and the doctor says, oh, you're fine. They'll do a serum magnesium. Oh, it's normal. It's just anxiety. Here, take this, anti-anxiety medication or an antidepressant. So they don't have the test. We don't have it in our food. We process it out and everybody in the world these days has PTSD. That's what I think.
Yeah. I could see lots of truth to that.
Lots of trauma. Yeah.
I have lots of questions, but I think I would love to maybe go through some of those symptoms that are rooted in the magnesium deficiency. Like, how do we hook people into feeling, oh, that could be me? What are some of the common symptoms that are downstream that then would have people to have symptoms and challenges and maybe chase the biohacking?
Yeah, good point. So head to foot, you do get brain fog with magnesium deficiency because you can't clear toxins. You can get eye twitching. You can get kind of choking, you can't swallow more than one pill at a time without gagging because your esophagus is kind of in a spasm. Anything to do with muscles will cause spasms or twitching. And then you can get heartburn because your diaphragms are in spasm. You can get IBS, especially the IBS constipation, but even IBS diarrhea because the intestinal muscles go into spasm and block gas and cause pain. You can get insomnia, leg cramps. I mean, Charlie horse leg cramps, when you try to stretch when you're lying in bed and you get a horrible calf cramp. That's magnesium deficiency. Even restless legs. And actually, when I'm thinking about cramping, I think of these incredible gymnasts who they're stretching and doing all these things. And you know why they don't suffer from cramps? The chalk that they use on their hands for holding the bar and everything, it's a magnesium chalk. So they're constantly absorbing magnesium.
I didn't know that.
And I mean, any muscle in the body, when you think of the fact that there are 600 muscles in the body, any one of them can be spasming. I've had people that, that almost like a torticollis neck spasm, and they've been told they might have to have surgery to relieve that spasm. And it's magnesium deficient. Heart attack. Heart attacks are the heart muscle going into spasm. Blood pressure, the lining of the arteries, they're lined with muscles, and that muscle tightens up and you get high blood pressure. I mean, it goes on and on. The enzyme that makes cholesterol, or I should say that either makes or doesn't make cholesterol, is guarded by magnesium. And that's the enzyme that statin drugs kill. So if you have enough magnesium to make your cholesterol go into balance, you're good. Researchers, magnesium researchers call magnesium a natural statin. Same with blood sugar. If you look at a medical text under triggers, causes of diabetes, one of them is low magnesium, but doctors, because they've been, channeled away from nutrients, down the dark road of drugs, they don't even think about giving people magnesium. And then if they do, they give them magnesium oxide. That's a flat out laxative. It's only 4% absorbed. So
not going to help compliancy. They're not going to want to take that again.
No, never.
Yeah. And I've experienced that, even taking certain magnesiums and being like, well, I didn't feel anything. So I mean, that's the other end of the spectrum. It's like, oh, I experienced that where I didn't feel anything. So a lot of people are probably listening saying, oh yeah, I have that. I get the muscle cramps. I get the restless leg. I get the brain fog. Do you think that is enough to say, hey, we need to start saturating our body with more magnesium, or should we be testing?
I think it's enough because what the laxative effect is, it's quote a side effect, but it's also the fail safe. If you're quote taking too much magnesium, you'll get the laxative effect. So it can never build up. It can never be whatever toxic, and you can never take too much. But The unfortunate part is that most magnesiums are laxative, so you never get enough. You'll take a little bit, like you say, you may not feel anything. And then you'll take some more and, oh, okay, I feel a little bit better. And then if you take another dose and you get the laxative effect, you say, well, that's that. I'm not going to be running around town with the laxative effect urging me on. So it's a difficult thing about testing. Like I said, the serum magnesium test is a real failure. People are using the red blood cell magnesium test to check their levels. And what I say is you can check your symptoms, look for a list of magnesium deficiency symptoms. I've got a couple of magnesium books out. A new one, actually, Magnesium, the Missing Link to Total Health, will be out in a week or so. So I'll list the symptoms and you say, oh, okay, yeah, check. And then you take your RBC, red blood cell magnesium test, and see where you're at. I think the range is like 4.2 to 6.8. You want to be up in the high sixes. You don't want to be 4.2. If your doctor says, oh, you're 4.2, you're fine. You're not, because what you are is down with the other 80% of the population who's deficient in magnesium and having symptoms, because laboratories, they will take the average of the laboratory population and just do a bell curve. It's got nothing to do with normal or optimum or even natural. It's just the range of the sick population. And in the past number of years, the level of magnesium deficiency on the lab test has changed because more and more people are so deficient. So so there's that. But there's also an ionized magnesium test that I've been doing university research studies with our magnesium formula, which is a picometer size stabilized ion of magnesium that's fully absorbed at the cellular level. So, this university study wanted to say, really? How is that possible? So they're studying it and comparing it, that formula with other magnesium formulas, and finding out high absorption with an ionized magnesium test, an IMAG test. Now, right now, that's only available in university settings and ICUs. But with our studies and a number of other experts and researchers who are saying we've got to get better at this magnesium testing, I think it's going to be more available. And actually, one of our a 2-year follow-up on the blood we took from our human clinical trial, we found that you could store blood for 2 years and still be able to run an ionized magnesium test after 2 years that had the equivalent reading of 2 years prior. So that means people can go to a lab, take their blood, freeze it, and send it off to an IMAG testing. So that's in the future, but don't hold your breath. And that's why in all my writing and speaking, I tell people it's so safe. Start slowly, start low and slow, build up. With our liquid magnesium, for example, you just put it in water, to which I add sea salt. I think the sea salt with 72 minerals can really be beneficial in ways that we haven't even studied yet. So people will just, take their mineral water with their sea salt and just sip it through the day as they would any amount of water. Water guidelines. Water is very important when you're taking extra minerals, because it's the water inside the cells that kind of drives the metabolism. So I'll take body weight in pounds, divide that in half, and drink that many ounces of water a day. And in each liter of that drinking water, put a 1/4 teaspoon of a good sea salt. And a good sea salt means it still has some coloration to it. If it's a refined sea salt, it'll be white. And if it's, pink or brownish or copper colored, it means it still has its minerals.
Great. Very
Really good
helpful.
point.
Mhm.
Can you talk to us about the different forms? Because there's so many different delivery formats. And you talked about oxide, which is typically a laxative, but I'm hearing more and more clients coming to me, should I do 3-8 or glycinate or the chloride? Can
Mhm.
we settle some confusion around here?
Yeah, sure, Lauren. That's really important because, yeah, you have so many, and then you'll have the promoters of the different brands talking about how cool theirs is.
Mine is the
Okay,
best. Yeah.
yeah, yeah.
Yeah.
So the oxide, it got promoted because some smart woman who owned a magnesium oxide company, she gave the magnesium researchers free samples back in the day. So all they did was study magnesium oxide. And even then, with only 4% absorption, everything benefited. Brain to your cramping toes. It's amazing how important magnesium is when even something so poorly absorbed can be helpful. 3-8 bugs me very much because they did a rat study with the magnesium 3-8 and said it's the only magnesium that gets across the blood-brain barrier. It's not true. Magnesium oxide does as well, but somehow they created this big media thing. It's a patented magnesium. On the bottles, it often says 2,000 milligrams magnesium 3-8. And you think, wow, I'm getting 2,000 milligrams of magnesium, but you're not. You turn the label around and it says, in every 2 capsules, you get 144 milligrams of elemental magnesium. So for me, I needed to take 1,200 milligrams to get rid of my heart palpitations. I would have had to take 20 of those, and I would have died on the toilet with, the laxative effect. So what they're saying there is, yeah, they're it's false advertising for one thing. But see, the other thing is 3-8 has brain effects. It can help your mood and anxiety and depression. So they're actually, making it seem like the symptoms that are relieved by magnesium L-threonate are due to the magnesium, whereas a lot of them can be due to the 3-8. And because you have so little magnesium, you are not solving your magnesium deficiency symptoms. You're just doing what the 3-8's doing. So it's really quite false. And it's the same with all the other combination compounds, because what happens with a magnesium compound is that it's bound up. Let's take magnesium chloride, which is the base of my formula. So you have magnesium and you have the chloride, and it's in the bloodstream, going around, and because it's in a fluid, it will disassociate. It'll disassociate for fractions of a second, and then join right back up to either the chloride or something else, because magnesium is so hyperreactive. So in that brief flash of time, it can be absorbed into the cell. Boom. So that's all that's what happens to the compounds. I mean, when you get a stabilized ion that I've worked on, then you have a chance to get the absorption of all the magnesium ions in the formula. So all of these various compounds, just like I said about the 3-8, it's mostly 3-8 in a magnesium 3-8. In the glycinate, it's mostly a glycinate, which they say, oh, well, glycine's good for you too. And it's like, yeah, glycine is good, but you're looking to saturate 80% of your metabolic functions with magnesium, and you're not going to get it with a compound. So does that make sense, Lauren?
Yeah. And I've had several clients that don't tolerate glycine in any form, but you Google which magnesium is best and it's magnesium glycinate. So people take it, and I've seen not great results. And also with the 3-8, there's a very popular podcaster that I think we all know that's always pushing the 3-8. Got a lot of clients that are buying into it, and no change.
And, yeah, buying into it is exactly the right terminology, because when it first came out, it was a certain price. And then they totally made it, I think they patented it beforehand, but then they tripled the price of it. They actually tripled the price. So, and you have to figure there is a placebo effect to any of these things anyway. So in the beginning of taking something, it's like, wow, I've read all this awesome stuff. You know, they're buying the PR. You are purchasing the words and then putting it into your placebo mind and thinking this is going to help.
Sure.
So after about 3 months, you know, when symptoms start coming back, then people go, oh, now what do I do? And they're turned off taking more magnesium because of the laxative effect. And then they go on to, oh, let's try ashwagandha, let's do this, let's do that. And you get this whole list. I mean, seriously, I come across articles that will say, oh, the top 8 nutrients for the brain or for this or for that. They don't even include magnesium anymore. It's kind of looking for the next best thing or the next sexy
Popular kid on the block. We can
popular
market.
kid on the block. And it is driven by people who have symptoms and they want to get better, and the whole biohacking world is based on, well, let's see how much of this I can take and if it makes me feel better. Well, when you take a high amount of, I think, anything except a good magnesium, you're going to throw so many other things off. I mean, in my world, I heard so much about the high dose iodine. And then in my clients and then customers, I would find people who said, I just burned out my whole iodine picture because I took so much. I'm now allergic to iodine. I can't take any. So you get that problem. And actually, just a sidebar on the whole iodine thing, people think it's good for their thyroid. The 50 milligrams of iodine came out because of cancer treatment, breast cancer, etc. And then people without those symptoms began taking it. Iodine is necessary for the thyroid. Yes, it is the mineral that's in the thyroid hormone molecule, the T3s and T4s. The T3 means 3 iodine molecules, T4 means 4. But in order to make thyroid hormone, you need 9 minerals. You might have heard selenium is important. Yeah. But then there's boron and molybdenum and zinc and copper, magnesium, of course. So we've really gotten so far away from the natural way of treating our body with the right cofactors that even in alternative medicine, they wait until the thyroid crashes, you get hypothyroidism, and you do replacement therapy, synthetic replacement in allopathic medicine, and then natural, quote, natural replacement with alternative medicine, but it's still replacement instead of giving the building blocks.
Or getting curious about why it's been pushed out of range in the first place. Right.
Magnesium or just nutrients in general.
Yeah.
Well, actually, I just did a critique. I wrote a blog, but my COO, Ginny, she said it's just it's too much, because it's this doctor saying, well, vitamins and minerals, they don't help cardiovascular disease or cancer. Why do we even bother? Why do we have to put up with these questions from our patients? I guess we have to, just hang in there and tell them what's real. I mean, it is such blatant, patronizing insanity that you can't imagine, in this day and age, that doctors don't even know that vitamins and minerals are necessary for the body. And they just, it astounds me, but that's the brainwashing. The funding for research now, university research is all focused on drugs because it's big pharma pays for it, and nobody's doing supplement research. I mean, my company is able to do a little research, but most supplement companies don't bother. So it's,
Yeah.
when I went into med school in the mid 70s, I went in already having read Adele Davis and Prevention Magazine, and I was so keen. And, I kind of toned myself down a bit, uh, necessarily. I mean, I was blackballed because I was making my own yogurt in med school until the dean of studies came in and said, hey, Carolyn, can I have your yogurt recipe? So people backed off, and I was doing acupuncture in a second year elective. I mean, I had a good time in med school because I had this detachment that I knew that nutrition and lifestyle and making your own bread and own yogurt, etc., was important. And I sincerely believe that within 10 years, all doctors would be doing lifestyle medicine. And after, during my internship, actually, I did post-grad naturopathic training. And again, I thought it won't be long. It was terrible, the way we just went down the dark side of drugs. And you will hear these doctors say or read where they will accept all these side effects because they get in weight loss drugs now, huge, you get an 8 to 13% drop in weight, and they say this is a great drug. And then after a few months, 75% of the people dropped out of the study because of the side effects of nausea, vomiting, and diarrhea. And it didn't occur to them in month one, well, too many people are getting sick. Month two, month three, okay, we better pull the study. And it might have even been longer. I think the study was 32 weeks. And somehow they accepted. When I was in med school in the mid 70s, doctors would say use medication for the shortest time possible while your patient is healing and metabolizing their own resources. Drugs, shortest time possible. Now what do we have? Lifelong drugs. Blood pressure, here's your 3 drugs. And what happens with blood pressure, which is usually white coat syndrome to start with, they're put on the blood pressure drug, they come back, blood pressure is worse because the diuretic drug they've been given gets rid of more potassium and magnesium. And they're put on 2 more drugs, calcium channel blocker. Magnesium is a natural calcium channel blocker. So then they come back on these 3 drugs and, oh my gosh, look, your cholesterol is high and your blood sugar is high. We caught these just in time. They say, good thing we caught them. We can put you on a statin now and a diabetic drug, and you'll be good.
Yeah.
And then they'll give a blister pack, that you just take one of each of your 5 or 6 drugs every day. It's horrifying because it's totally, follow the money.
Yeah.
So sad. So sad.
Yeah. I mean, you were way ahead of your time in medical school that you were already thinking about nutrition. And I didn't realize you were aware of nutrition so much before you went to school. I was going to ask you if you discovered that in medical school, but you were already so passionate about it.
Yeah, Lauren, I'm one of the few doctors who did not get out and practice and kill a few people before they realized that they better do something to help their patients, or the doctors who get sick themselves weren't helped by drugs and whatever and began doing natural. I was so blessed that, I opened my practice as a medical doctor, because up in Canada, people had free medical care, so they got taken care of. But I practiced as a naturopath because that's, where my heart was. First, do no harm, look at the root causes and give people things that don't cause side effects. I mean, it's only common sense.
Yeah,
absolutely.
Makes sense to me.
Yeah.
So, you also mentioned calcium. I'm just curious if you can speak to that a little bit, because I'm still seeing, especially women as they're getting older, their doctors are saying, take more calcium.
Yeah, well,
yeah,
calcium.
so let's talk about it.
Yeah. Yeah, the calcium has lost its flavor, I'll tell you that
Yeah.
much. I've written I've written articles. What was one of the titles? Why I Hate Calcium.
Oh,
Now, the
yes.
thing is, calcium is very important, but we can mostly get it in our food. When doctors started looking at women breaking their bones and the osteoporosis, they leapt to the conclusion that, oh, you need more calcium, whereas there's, over a dozen things that make up our bones, including magnesium, including vitamin C that makes the collagen, the soft matrix of the bone that makes it a little more flexible. If it was just a calcium bone, that would be like a calcium carbonate. You drop it and it shatters. So that's what was happening to women who were taking their, 1,500 milligrams of magnesium a day. They were starting to get more fractures, and they were getting more heart disease because calcium is very poorly absorbed. You need vitamin D to help absorb calcium, and you need magnesium, both of which are very deficient. So people were, women especially, were getting all this extra calcium. And what was it doing? It was precipitating in soft tissues. So from head to foot, you're getting, all kinds of weird dental problems, fluorosis, different things, because calcium is depositing willy-nilly. You're getting breast DCIS, the breast tissue calcification that doctors call a pre-cancer, which just freaks everybody out. They sort of pretend it's a cancer, but it's a calcification, because I guess calcification can be a factor of later stage cancer. But anyway, so that was horrible. And gallstones, kidney stones, heel spurs, and atherosclerosis, as calcium is depositing in the blood vessels. Studies out of New Zealand, there was a half a dozen by a Dr. Boland, Bolland, and he found that women who just simply take calcium supplements are at a higher risk of heart disease. So that started the conversation about how we really had to be careful about calcium. But doctors haven't got the message, really, because they don't have anything else. What I say is you probably need 600 milligrams of calcium. That's what they do in the UK and the World Health Organization. That's our recommendation, 500 to 700 milligrams. And then you need about 600 milligrams of magnesium. So I do like a 1-to-1. And most people, if they're eating some dairy, nuts and seeds, grains, and greens, and sardines with bones, they can get 600 milligrams of calcium. You can look this up on calcium food lists. And then you can live without a calcium supplement. But I know myself, when I started my super magnesium saturation, I didn't take calcium supplements for a couple of years. And then I started to get knee pain. And my knee pain reminded me of my biohacking of doing IV chelation. I'd set up my own IV, I'd put on the tourniquet, I'd, jam in it's so much fun. But after about 3 chelations, my knees ached. And I said, oh my gosh, this stuff is stripping my minerals, and I'm not putting them back. And how do I know what I'm stripping? So when I get sort of knee things, I say, oh my gosh, I'm not taking enough calcium. And I did make a picometer calcium so that I could take 1 or 2 teaspoons, which is 300 to 600 milligrams when I needed it. And seriously, the knee pain goes. So, what happens, with people, I'm in my, do I say seventh decade? I'm in my 70s, and I actually feel healthier than I did in my 30s because I've overcome my magnesium deficiency and all the things that go along with it. And I'm constantly experimenting, like I did last night, experimenting with chocolate. It was fruit chocolate, though. It was very healthy, but
Right.
man, it slammed me.
Oh man, we
We've
do
all
it too.
experienced that.
Always
Yeah.
experimenting. Yeah. So I
Yes.
guess in terms of experimentation, in addition to supplementation, what else can we kind of try in terms of food? I mean, you did mention that the soil is more depleted, but we can still get calcium and these other minerals from food. So what are maybe some common foods that people are overlooking that we could at least try to integrate a little bit more?
Right. I think the best way to approach diet and food these days is to make sure people are avoiding processed food.
Mm-hmm.
The ultra processed food now is killing people. The only sort of decent nutrition study I've seen recently, it was back in 2019, Dr. Kevin Hall. He studied ultra processed food and compared it to, an ordinary SAD diet, standard American diet. And he found the people in a confined setting, he booked them into a clinic. The ultra processed food diet people, they would eat an extra 500 calories a day compared to the other diet. And then he was like, oh my gosh, what's happening? I have no idea. And seriously, common sense, what we've known for decades is that if you're eating crap food that has no nutrients, you eat more and more of it to try to get more nutrients out of the crap food and you gain weight. So that's as far as they've gotten with studying nutrition. So anyway, you have to avoid all that. You really have to focus on organic as much as possible because the GMO foods and the non-organic foods, they are sprayed so badly that people are building up a lot of toxicity. One of the first things I did when I moved to Maui 14 years ago now was hook up with a biodynamic organic farmer. And I've been supporting him and funding him for the past 14 years. And even though it's awesome what he does and he amends the soil, I can't live on strict vegetarian diet. My heart palpitations come back when I do that experiment. So food wise, and stay away from the dead food, try to eat live food. And then with the live food, fruits and vegetables, yes, but you do have to watch out about the fruit. You can actually increase your triglycerides if you eat a lot of fruit because it's fructose. It puts extra strain on the liver to metabolize fructose than it does even our glucose blood sugar. So, and especially with the yeast overgrowth population, you really should only be eating about 2 fruit a day. And, because of my history with yeast overgrowth, man, in med school, I got these crazy staphylococcal nasal boils on top of my yeast. And what I realized when I did an AIDS and chronic fatigue study in New York back in the early 90s, that when you have yeast, you create the environment in your body for all the other infections. And 100% of people with AIDS had yeast overgrowth. And then when we did all the viral and bacterial markers, they had everything. So yeast sets up your immune system to catch all these other things. So that's why I say, yeast is the other part of my magnesium deficiency yeast overgrowth theory of chronic disease. So with knowing all that, and I mean, seriously, for 10 years, I didn't eat any sugar. I would smell desserts and say, oh, I remember that. And sugar, wheat, and dairy. Back then, it was just avoiding wheat. Now we avoid gluten as well. And it was hard, rotating antifungal herbs and the whole 9 yards. But then I started working with Saccharomyces boulardii, which is very gentle antifungal, and fulvic humic, which is a good soil-based probiotic, ground substance, and inulin, which is like a prebiotic. So I work with that and a picometer silver. those two things together with kind of a modified yeast diet has been awesome, because we can't be so strict, especially in our PTSD world, where, I say we've all got PTSD. We're all stressed. We're all kind of, vibrating with too much concern. We're in a fight or flight, and that produces cortisol. It keeps our yeast, ramping up. I mean, it's so. I said, people really do have to do almost a daily anti-yeast routine. So, where were we?
Yeah,
Where were we?
I think our modern day world is very yeast promoting. And I'm glad that you brought that up about the connection with immune dysregulation or immune deficiency. I think a lot of people still think, oh, too much sugar is just going to make me gain weight, or it's just going to make my child run around like a crazy person for hours. But it's disrupting the gut and the immune system. It's really, really powerful. Yeah.
Yes, exactly, Lauren, because the whole gut thing, what has that turned into? Oh, the microbiome. Oh, it's SIBO, small intestinal bacterial overgrowth. Oh, we have to take a lot of probiotics. Oh, what do we do? What do we do?
Yeah.
Oh,
let's kill the pathogens, kill the parasites.
Yeah, and if it's SIBO, they just use more antibiotics. And then allopathic, we go to fecal implants. So we've forgotten yeast in that whole bucket of the microbiome. And the focus has been on lactobacillus and bifidus, where we really need soil-based probiotics, which are the real, hard workers in the intestines. And when you have yeast overgrowth, the budding yeast from the large intestine, makes its way up into the small intestine, pokes holes, creates that leaky gut, and then yeast toxins, and there are 78 of them. They migrate, they get absorbed into the bloodstream and cause the foggy brain, and the toxins come out in the skin as skin rashes. You've got the coated tongue, itchy ears, itchy eyes. So we all are subject to this yeast. I mean, look what's going to happen over the holidays. Everybody's just going to, get stressed out, and, alcohol and sugar and all the rest of it. And that's why we have the big dieting push in January, because of all that buildup. But like you say,
yeast detox.
Yeah. And like you say, Lauren, people just focus on, oh, it's weight gain, and if they're even, with common sense, are reminded about the sugar highs that kids get. I mean, that's incredible what happens to kids when they eat sugar. But anyway, how are we doing? How are we doing?
Yeah, that's great. I'm so glad you brought that up.
Yeah, we are nearing the end of our time, but I wanted to circle back to magnesium specifically because you have some pretty awesome formulas. But I just wanted to close the loop on testing and kind of knowing how much is right for us. And I think the way in is a personal story. I was testing my magnesium RBC with a lot of different magnesium products, taking the recommended dosage, which actually was way too low. So I'm so glad that you mentioned how much you were taking, almost permission to kind of experiment. And then do you just check back in on the lab test to make sure that you're hitting that upper threshold? You said around 6.
Right. I mean, you can check back. And of course, it's important for you all to do the blood tests, and because you're giving information out to your people, and you're doing it very, very logically and properly. But for most people, 1 or 2 tests just to make sure that when you take extra, it goes up. Seriously, when I did my some testing and found my vitamin D was 19 and it should be 60, and I live here in Maui, and I wasn't getting sun, but I did not feel vitamin D deficiency symptoms, whatever they are, because they're kind of ephemeral. My magnesium was in the high 6s. My vitamin D was 19. I started taking 10,000 units of vitamin D. I might have been taking like 2,000 units. After 4 months, my vitamin D was up to 58, and my magnesium came down from mid 6s to 4.8. Right. And I realized what we know about vitamin D is it's activated by magnesium. So as my vitamin D went up, using up my extra magnesium to activate it, my magnesium went down. So that was my experiment. It's like, oh my gosh, there's the proof. I take high dose of vitamin D and my magnesium goes down because it's being utilized. It was pretty awesome. So that's what's going to happen with your blood test, So
Yeah.
take your baseline, especially my picometer magnesium, then it'll be really well absorbed. Do your repeat testing in 3 or 4 months, and then you'll say, okay, I've got good absorption, and then just stick with it. But then you look at your symptoms. Have you gotten rid of your symptoms? I mean, one thing that we found with people who were just taking the magnesium for about 3 months, they would start getting yeast die-off symptoms. And they didn't know, well, gosh, I was feeling so good, and now I'm kind of foggy, and I've got gut problems, and I've got this rash. What's going on? And we said, great, you're doing a yeast detox. Good job. Good job. I know, isn't it funny when we say that to people? So, and that's where they need to go a little more into taking the yeast treatment protocol. So it's really cool how the body will tell you. We really have to get people listening to their bodies, because doctors, I mean, for too long, they just, oh, you're okay, pat on the head, take this pill and, see you in a month. It's crazy. It's really terrible when we know there's so many things that can help people.
Yeah. Yes. Well, thank you for all that you're doing above and beyond the annual lab. You're fine. See you next year. So thank you for all that you're doing and sharing your wisdom about magnesium. Something you just said, I'm curious. My vitamin D has been very high lately. I actually stopped supplementing. I need to go check my RBC magnesium because I'm curious if there's something there. So I'm going to experiment. We'll see. Yeah.
That's what we do. It's a constant experiment. And N equals 1.
Yes.
Right?
That is right. That is
Love
right.
that. Love that.
Yeah.
Well, thanks, Carolyn. We would love to ask you just one final question, one final piece of advice for our audience, something they could start doing today to optimize their health. What would that be?
Maybe just drinking water. I've already said it, half your body weight in ounces of water, and get a good, like a Himalayan or Celtic sea salt, quarter teaspoon, but just start with a pinch. And you'll find after a short time, it's like water so bland without the minerals, because that's where we're supposed to get our minerals from, is our water and our food, and we're not getting it from either. So take water and I don't know, think good thoughts. I mean, appreciate. I walk the beach most days, and I collect smiles. I'll smile at someone or whatever, and they smile back. People can't help themselves. So go around collecting smiles and be in appreciation, and drink your water.
Oh, we love it.
Beautiful.
Thank you. So actionable and accessible. Anyone can do it now.
Anyone can do it.
Yes.
Well, thank you very much. This has been fun. I appreciate you, ladies.
We appreciate you. Can you share with our audience quickly where they can find more of you?
Okay, all my information, it's separate from my store website because the FDA, has a gun to my head. So my educational website is drcarolyndean.com. And my store website is rnareset.com.
Perfect.
Okay.
And that will be in the show notes as well. Make it easy to click. Thank you so much for spending your time with us today. This is wonderful.
Thank you. Oh, I appreciate you guys. Thank you so much. Bye-bye. Aloha and mahalo.
Mahalo. Yes.
And thanks to everyone that tuned in today. We'll see you next time.